This is J. Randal Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 29 of a 58-part video series of the entire book. If you have not already, please review our introductory video on our channel. Part 29 covers Chapter 8, Diet, under the subheading Salt or Sodium. When I first started and wrote this chapter, I thought I understood the impact of salt and sodium on the heart, on heart disease, and heart failure. Yet I pulled up the latest clinical trials and read them all and had to scrap the chapter. It turns out that most of the doctors in the cardiovascular and cardiology area have been taught to teach patients to go on a low sodium diet. The ability of sodium to increase blood pressure has been well known for many, many years. And high blood pressure or hypertension can increase back pressure on a weak heart, preventing recovery, and can basically cause the heart to continue to degrade until the person dies from sudden death. Excess salt consumption is the responsible reason that excess water retained by that salt increases the pressure on the body. However, the actual culprit is not the sodium consumption as long as it is in reasonable bounds. You're not binging on bags of salty potato chips and bags of salty popcorn and extreme levels of salt in foods. If you're consuming salt as you feel that you need to taste it, the primary problem in the American and Western diet is the reduction of potassium in fast foods and packaged foods found in grocery stores, especially frozen foods. So many of them have removed the potassium that's necessary for the kidneys to regulate your blood sodium level. So what actually rises in increased blood pressure is when the ratio of sodium to potassium increases. One clinical study found that a steady increase in sodium over potassium caused a linear steady increase in hypertension or blood pressure. The kidneys can easily regulate your blood sodium level as long as they have enough potassium to work with. That is the secret to proper sodium levels. Now, regarding the clinical studies, it turns out that a sodium intake study released in April 2011 in the Journal of Cardiac Failure was conducted by the University of Kentucky School of Nursing. They sought to discover if a 3,000 milligrams of sodium each day increased survival in persons with advanced heart failure. Now, 3,000 milligrams is a small reduction from the normal American diet in fast foods. What shocked the doctors is that persons with advanced class 3 and class 4 heart failure had fewer cases of death and hospitalization at 3,000 milligrams, and those with class 1 and 2 mild heart failure with sodium intake under 3,000 milligrams, that is on the low sodium diet, had a significant increase in cardiac events and deaths. This group did not have enough sodium in their bloodstream for proper heart function. The managers of the study were quite beside themselves that they lost so many patients, and the healthier patients at that. So research was conducted to find out what was the cause. It turned out that doctors were routinely prescribing diuretics, that is, medications that cause the body to excrete sodium without regulation the way kidneys normally do. Therefore, as a result, the diuretic medications, which are more effective in stronger class 1 and 2 patients, caused a higher death rate among those patients because they did not have enough sodium for their heart to function. This is revolutionary information. Most doctors have never heard it and have not kept up with the latest trends. The increase in deaths also occurred with sodium levels above 3,000 milligrams per day, so there's a sweet spot. Essentially 3,000, and in another study 2,800 was the group with the highest survival rate and the lowest mortality. A study in London in 2008 compared two groups of patients totaling 232 men and women. They recorded readmission for hospital care to treat congestive heart failure events for a period of 6 months. The group restricted to 1,800 milligrams of sodium had a significant increase in cardiac events compared to the group receiving 2,800 milligrams of sodium. So normal sodium levels improve survival. Inadequate or low sodium diets increase mortality or rate of death. The final comment of the studies: further studies are needed to determine if it's the diuretic medication dosage depleting their sodium levels or just the low sodium diet. Now, one researcher reports that Americans consume on average 3,400 milligrams daily of salt. Some consume more because of packaged foods. There are some foods that are extreme killers, like mashed potatoes with gravy from Kentucky Fried Chicken. It's listed in their nutrition supplement as 2,040 milligrams of sodium. 3 pieces of Kentucky Fried Chicken exceeds 2,000 milligrams of sodium, and a single chicken pot pie is nearly 2,000 milligrams. So your budget is approximately 2,500 to 3,000 milligrams had the lowest mortality rate. You don't want to blow your budget on fast foods, eating 2/3 to the entire daily limit in one meal. So you still have to watch your sodium intake. 2,000 to 800 to 3,000 milligrams is approximately a half teaspoon per day. That's it, 1/2 total. We don't want to drop too low because even animals put on a low sodium diet die. Sodium can be found in a lot of strange ingredients that you may have never thought about, like MSG. It's monosodium glutamate. Baking powder. Other additives in baking goods: sodium hydroxide, sodium caseinate, disodium phosphate, sodium benzoate, sodium sulfide, sodium alginate. Sodium is available in so many different packaged foods, and you have to watch carefully the panel, that is the nutrition panel on the back of the package. It's usually deceptive, and they do this by stating a serving size that is roughly half or even 1/3 of what normal Americans, or humans for that matter, of all nationalities would actually eat. For example, on a can of soup, if you check the panel, it might say 790 milligrams of sodium per serving. But that can of soup fills only 1 bowl. And if you look at the fine print, that serving size is a cup, not a bowl. So you have to multiply by 2 to end up with 1,580 milligrams of sodium in a normal can of soup, which fills a normal standard bowl. There is a way to check for magnesium and potassium levels in your cellular walls, and that's called the EXA test, EXA. It also happens to check your sodium levels inside your cells, the cells of your body. So it will tell you, if you conduct a test for magnesium and potassium under doctor's orders, it will tell you what your sodium level is inside the cells and not just in the blood. The next time you're at McDonald's or Burger King, ask for their nutrition chart. You will find some foods that are reasonable. You'll find some foods that are outrageous, killers. So watch yourself. Success with Heart Failure was a book by Dr. Mark Silver in which he recommended no more than 2,000 milligrams of sodium per day. However, that information is now dated. It predated the latest clinical trials that showed an amount of 2,000 would increase the actual mortality rate of heart failure patients. So if you're taking diuretic medications, you need to watch and work with your doctor carefully to avoid bottoming out on your sodium levels. It could be very dangerous to your health. If you are not taking diuretic medications that wash out sodium with an unnatural method, it may be possible to reduce your intake to 2,500 milligrams, but so far among the most recent clinical trials, the sweet spot of high survival rate is between 2,800 and 3,000 milligrams. You can imagine my horror if I had written this book before those clinical trials. I would have been recommending a practice that would have increased mortality, the rate of death among the readers. Fortunately, I waited until I had collected all of the scientific information and clinical studies, and that took 4 years to accomplish. This concludes this section on the heart failure recovery plan. My name is J. Randal Wilkerson. You can obtain this book from Amazon in a print and Kindle edition, from the Apple iTunes Store in an iBooks edition, from eBay in a print edition, and from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just enclose a check for $24 to cover the book plus shipping and handling. Thank you for listening.